Hello dear friends, welcome back to our presentation, Your Health and Your Salvation. I am your host, Pastor Maurice Lowe, and today we will talk about cervical cancer. Here is a diagram of the cervix. The cervix is located at the bottom of the uterus or the womb. So cervical cancer takes place in this area of the woman's reproductive system. Why is cervical cancer screening so important? Well, most cervical cancer occurs in women aged 30 to 59, so in kind of younger women. Every year, cervical cancer kills about 300,000 women globally. 300,000. More than 85% of these deaths occur in less developed regions of the world. So that makes really sense, because in poorer countries, in less developed countries, you have not so great healthcare system. When it comes to the matter of screening, women don't really get screened. It's very, very limited. And of course, treatment option is expensive. So 85% of these deaths occurs in, less developed countries. And it's one of the most preventable and treatable disease, if it is caught early, so that you can have proper treatment option. And according to the World Health Organization, every 2 minutes, one woman dies from cervical cancer. Every 2 minutes. So this is a very deadly disease, and the incidence is very, very high. Now, pertaining to what causes cervical cancer is actually caused by the human papilloma virus. We call that HPV. And it's a necessary cause of cervical cancer, but not the only cause. That's important. It's not the only cause, but it's a necessary cause. And these pictures just shows us what the HPV virus actually looks like. It looks very beautiful, but it's very deadly. So it's a common virus found in men and women. So this is a virus that's so common, friends. It's almost like the common cold. So it occurs both in men and women. And one of the things with cervical cancer is that with HPV is that you cannot just look at a person and figure, okay, they are free from HPV, right? You can't. And this is what makes it so really dangerous, because it's common in both men and women. And there are over 100 different types of HPV. 100 different types. You have the high risk HPV, which can cause cancer, and you also have the low risk HPV that causes the genital warts. So HPV infection goes away on its own, and that's a good thing. So if the person's immune system is firing on all cylinder and the person is taking very good care of their health, you find that your body defense system, immune system, will just take care of the HPV virus. But if for whatever reason the person's immune system gets weakened, then the chances of HPV manifesting itself and even causing cervical cancer, that will really increase. If a high-risk HPV infection in the cervix does not go away and it is not treated, it can lead to cervical cancer. So it's very, very important that screening be done to detect the virus before it actually causes cancer. So what are some of the risk factors, the main risk factors to really develop cervical cancer? Sexual activity now or in the past. So if you have been sexually active in the past or currently, the risk of contracting cervical HPV virus, which leads to cervical cancer, is greatly increased. Sexual activity before age 18. So if a female is sexually active before 18, then the chance of developing cervical cancer is increased. And if the female is I want to say the word promiscuous, goes around and sleep with Tom, Dick, and Harry, then of course the risk of contracting this virus is greatly increased. And if you have a partner that have many sexual partners, that even makes it worse, because promiscuity will actually increase this, not only with HPV, but syphilis and gonorrhea and AIDS And that's one of the reasons why it's so important to practice our sexual activity within the confines of marriage, and for us to really be faithful to our partner, right? Very, very, very important. Because when we obey the laws of God and the laws of health, we protect ourselves from these diseases. No, I am not saying that if you're monogamous and you're faithful to your wife or husband, right, you can't develop cervical cancer. But of course, your chances of developing cervical cancer is greatly reduced when you're faithful in your marriage and you're faithful to God. So let us continue. So other risk factors include having a weak immune system, just as I said. Because once your immune system gets weak, then you find that the HPV virus can manifest itself and can lead to cancer. Smoking and exposure to secondhand smoke is also another risk factor. So if you smoke, or if you're exposed to secondhand smoke, so even if you yourself don't smoke and you have somebody in your office or in your family or your friend, you hang out with your friends who smoke, secondhand smoke is really dangerous and it will increase your risk of cervical cancer. Having other sexually transmitted infections, right, STI, that just makes sense. So if you have had, gonorrhea or syphilis or any other sexually transmitted diseases, that will increase your risk of cervical cancer. Using the birth control pill for more than 5 years. Yes, the birth control pill, using it for more than 5 years will increase your risk of developing cervical cancer. And if you have more than 5 full-term pregnancies, that will also increase your risk. Because of course, to go through birth, it's very traumatic and the cervix. So if you have had more than 5 full-term pregnancies, that will increase your risk of cervical cancer. And what are the screening methods, or what's the screening method that is commonly used? It's a pap test. And the pap test is a test to check for any changes in the cells of the cervix. These changes do not always mean that, the person has cancer. It does not check for sexually transmitted infection. So the pap test doesn't test for STDs. It doesn't. It just tries to really, detect those abnormal cells in the cervix, which can eventually develop and lead to cancer. A regular pap test prevents cancer and save lives because it can be detected early before it starts spreading and before symptoms start really appear. So ladies, I would really recommend that you get your pap test really done. It's a simple test and it might well save your life. Now, this pertains to statistics in Ontario, the province where I actually live. These are just some guidelines. The guidelines in your country or your province might be different. So make sure you really speak to your healthcare provider, your physicians. But in Ontario, all women start having pap tests within 3 years of first sexual activity. And the pap test should be done every year. And after 3 normal yearly tests, the pap test can be done every 2 to 3 years. And the pap tests continue until at least age 70. So in Ontario, it's not recommended that ladies over 70, continue to do pap tests. So the emphasis, ladies, is just be screened. Be screened. So regular pap tests can prevent cervical cancer and save lives. And what is also important, ladies, is that we obey the laws of God. We are, first of all, sex according to the word of God, according to the Creator, should be enjoyed within the confines and the responsibilities of marriage. And for those who are really married, is to be faithful to God and faithful to your partner. And this is very important. And additionally, get screened. Now, I want to talk a little bit about reducing your risk, because this is really important. And these are some of the things that can definitely reduce your risk of developing cervical cancer. Most importantly, get screened. Get screened. Consult your physician, your healthcare provider, and follow their recommendation and get screened as per your own province or country's guidelines. Reinforce your immune system, very, very important, because remember, is when your immune system gets weakened, that the HPV virus, if it's inside your cervix, can basically trigger off cancer. So in terms of getting your immune system reinforced, get enough sleep, rest, and physical exercise, have a healthy diet, avoid alcohol and tobacco. So those are some of the things you can do. And definitely avoid tobacco smoke. Be physically active. Be physically active. Very, very important. And practice, when it comes to sex, practice a sexually moral life. Very, very important. And eat a healthy, simple diet. And it might be necessary to take vitamin supplementation, especially vitamin C, vitamin E, vitamin A, and also bioflavonoids and B complex vitamins. Very, very important. Now, when it comes to having a simple diet, one very famous author writes, if ever there was a time when the diet should be the most simple, it is now. Grains and fruits prepared free from grease and in as a natural condition as possible should be the food for the tables. And this is so important. In fact, the great father of medicine and one of the greatest philosophers, Hippocrates, says correctly, illnesses do not come upon us out of the blue. They are developed from small daily sins against nature. And when enough sins have accumulated, illness suddenly appears. In fact, Hippocrates also says, let thy food be thy medicine, and thy medicine be thy food. So my dear friends, it's so important that we pay attention to our health. It's a treasure that we have that is given to us of God. And we need to really be proactive and prevent disease. Proper diet, physical rest and activity, right? Avoiding alcohol, tobacco, be sexually moral, adhering to the laws of God will go a long way in help to reducing the risk of cervical cancer. I thank you very much for joining us, and I look forward to having you with us for our next presentation. Thank you very much. Your host, Pastor Maurice Lowe. Goodbye for now.